Hi, and welcome to Chapter 22, Special Imaging Modalities. Throughout this chapter, we're going to take a look at some of the advanced training modalities that require certification and a separate registry that you take in order to do these. Some of these special modalities you'll get to rotate through, so if you do have an interest in taking a look at angiograms or interventional radiology, CT, MRI, we will allow you that opportunity when you get out to internship. Typically that will take place in winter semester, but we do have a cross-sectional anatomy course where you'll be able to go to CT and MRI during the fall semester. So there are a couple opportunities before the winter semester. You can also take a look at some of the other areas such as nuke med, ultrasound that are not classified in our advanced certificates, but those are separate degrees that you earn. So you'll have that opportunity as well come winter semester. So these are all things to kind of keep in the back of your mind. If it's something that of interest to you, then we can certainly rotate you through those modalities to see these done. So when we're taking a look at these, there's a couple of them that I do have videos for you because the videos really explain what you're looking at much better than me just talking about it in a PowerPoint. So with angiography, just remember this procedure is done to demonstrate vessels. So we typically call it angiography, but the correct name is a conventional catheter angiography. You'll see examples of like the cerebral angiograms. You'll do those quite a bit, which demonstrate vessels of the brain. Venograms are contrast studies of the veins. And so here's what one typically will look like, and you can actually see that contrast media running through the veins and arteries through here. So these are your vessels that this contrast media has been injected into your patient, and then it flows through, and we're looking to see if there's any blockages. Interventional radiography is another area that's a specialty area that you can rotate through. This is a very stressful type of rotation. But they do use angiography for diagnosis of the disease, and they tend to have non-surgical treatment or correction of vascular problems that are taking place in this area. So with interventional, it's performed in the angiography suite with the angiography team, and it's usually in conjunction with the angiographic procedures. So here's some examples, again, vein therapy that can be done. So that's another specialty area where they're looking more for varicose veins, looking for stenosis, inflammation, those types of things. CT is probably one that you're a little more familiar with because people will go on a regular basis for CTs or MRIs that you may have known. And basically this is a modality that does what's called computed axial tomography. So that's where that CAT scan word comes from. So CT produces what are called axial images, or they're slice-like sections of a transverse plane that can be reconstructed. So you can see some 3D reconstruction technology that's used to put that in place for the radiologist to view. So your CT scanner is basically a movable table with a remote control. They do have a gantry that supports the X-ray tube and detectors, and then it operates just like our equipment off of DR. It's a computer system that takes those images. So we can do CTs of the brain, chest, neck, any orthopedic exams. You'll see them done a lot with trauma that comes through your department. You do inject contrast media into the patient. And so just be aware that if that's an area that's of interest to you, you do those needle pokes and butterfly needles, and you'll inject contrast media into the patient, and then you'll take a look at those organs underneath the contrast. So this is an example of that contrast enhanced CT exam. So this is an abdomen study. You can see those kidneys, your liver, some of the bowel. We can also take a look at the spinal canal. So if they're ordering something for, maybe they've had a myelogram already in the department, and now they're going to CT. And so here they're going to do a fluoroscopic procedure, and they're going to take a look at that spinal fluid and how it's being absorbed into the bloodstream. So here's an example of that spinal cord, and we're looking to see if there's any blockages. So anything like if there's a shift in the vertebrae and it's pressing against there. MRI is another one that you're probably pretty familiar with, and I do have some more videos for you to take a look at with these. MRI is, again, a non-invasive diagnostic modality. It does not use ionizing radiation, so it's operating off of powerful magnets that are going to produce a radio frequency pulse that's going to be produced into a radio signal in the body that can be detected electronically, and it provides the images to the computer monitor. So that's going to be digitized, and it's still sent off to PACS just like regular radiographs are, but the equipment is going to be different. So with your equipment, you're looking again at a powerful magnet. You have that gantry that your patient's going to slide into that magnet on. It's going to house some very powerful magnets, so you need to make sure that you have nothing of metal that could get pulled and stuck to the magnet, because then you're costing the hospital money where they're going to have to shut that magnet down and get the artifacts off of the magnet. So there's specific wheelchairs, stretchers, oxygen tanks. All of those are going to have to be made out of non-magnetic material so that they don't get pulled into the magnet. So again, it's very loud. So sometimes the patients will be offered earplugs. You'll notice that when you're doing the exam, you're in a separate room, but it's still a pretty loud sound that those scanners produce, and that's from those coils. So here's what one looks like. You do have a closed unit, and this are the ones that are open. So if you have a patient who's very claustrophobic, it's better to put them in the open MRI unit rather than enclosing them. They do offer sedation for patients, and so that's typically a question that they'll be asked, is if they are claustrophobic. If they are, then they will offer that sedative so that they can be a little bit calmer while having that exam done. So typically we'll use these on brain, synovial joints. You could do breast MRIs, spinal cords, those types of things. And so here's an MRI with a sagittal slice of the brain. And again, we're using contrast media to enhance certain parts. And so we have to, again, do injections for these types of exams. So again, here's some more with the arteries and some safety considerations. We really want to make sure that your patient, we have a whole list of questions that we'll ask. We want to make sure that they are no aneurysm clips, if they have a middle ear prosthesis. Some of the cardiac pacemakers can be of a concern because they can cause them to malfunction. And then some other conditions that we need to be cautious of is just those orthopedic pins and screws. And nowadays, most of those are going to be out of a non-magnetic. So even pacemakers, some of the newer ones, they are not going to cause it to malfunction. So it's really one of those questions you have to be concerned with: how old is the part that was replaced or inserted into your patient for that particular exam. We typically don't do MRIs during the first trimester of pregnancy. There's just not a lot of data on what it could do to the fetus, so we do try to avoid anything during the first trimester. So a lot of times with pregnant patients, you're still going through and asking if there's any possibility they may be pregnant. Again, with the MRI safety, make sure no wheelchairs, stretchers, unless they're designed for MRI, OT tanks. Make sure you don't have your credit card on there because it will wipe out that bar so it can't read correctly. Watches could stop. So those are some things that you want to be aware of for you when you walk into that room. One of the things that you should do when you have a patient with MRIs, make sure that you explain that they may be in there for a while, that it's going to be very noisy, that they need to reduce any motion. Some facilities will offer headphones with music. Some, especially pediatric centers, will have a device that they put over their eyes so that they can watch a movie, so they can choose what movie they would like to watch so that they hold still for that exam. With ultrasound imaging, and that's a separate degree, so they have an associate's degree that they do, and this works off of sound waves. It's a non-invasive procedure, so it's considered to be very safe. We use those a lot with the babies. So if they're checking for pregnancy and how the baby's doing, and it's just operating off of high frequency sound waves that produce echoes, and it's those echoes that they're picking up with the transducer. And they can do all kinds of body parts. So you're really seeing a movement with breast for the ultrasounds to be done over mammograms. So they will take a look at those. You can look at your kidneys, your heart, your vessels. Even in males, we can take a look at body parts for ultrasound images. So here's an example of an ultrasound, and this is a pancreas that we're looking at. So primarily, most of you are probably familiar with the fetal imaging and looking at the babies, but we do want you to be aware that there's other things other than the babies. And with the babies, they can do 2D and they can do 3D imaging. And we also do a lot with trauma with all of these. So you may have a trauma patient that you're doing some radiographs on and they are telling you hurry up because they want to get them off to CT or off to ultrasound to finish up that exam. Sometimes they'll come in and we'll do Doppler ultrasounds, which is sonography that can detect the speed and flow of the blood. So these are colored. So you'll actually see red and blue colorings on their markings on their screen when they're looking at that. Echocardiograms can be done. Again, that's used with a Doppler to check the heart valves and chambers. And basically, they're looking for any heart disease. And then you do have internal transducers that can be done with ultrasound. And these are especially used during early pregnancies. So if they're within the first 3 months, or 3 months, within the first few weeks, they may do a transducer. So it's called a transvaginal ultrasound that's being done in that situation. Ultrasound can have contrast enhanced, and so that contrast is injected through the IV, and I think that's kind of surprising to some students is that they don't realize that ultrasound does have some contrast exams that are done. Nuclear medicine is, again, another area that's a separate degree, and they are, oops, didn't want to leave my screen, so hold on a second here. So the conventional nuclear medicine techniques that can be done, they do insert radioactive isotopes, and that gives off radiation. So just be aware that if you're going to nuclear medicine, it is a type of radiation that's produced. They're going to measure it with what's called a gamma camera. And so you'll walk into the rooms, and the rooms are going to look very similar to the CT and MRI units. So your patients lay on the table, they do their scans, and they're looking at the function of organs and tissues. And then here's where those nuclei, these are called hot spots. And so this is where they tend to build up. And so those hot spots will tend to gather on areas that the patient's experiencing pain. Another area that's now part of nuclear medicine is PET, so positron emission tomography. So they're using nuclear medicine and CT. It's a combination of both. You're going to typically see these for imaging of the brain. So this is what a PET scan will look like. So that nuclear medicine is very similar to PET. So now, even though it's done with a CT machine, it's actually classified through the nuclear medicine department. And we can fuse images. So fusion imaging is where they will take like a CT and an MRI and a PET scan, and they'll fuse those together for the diagnosis. So they take those images and they've kind of put the images on top of one another. Mammography is another one that you can become certified in. So this uses special equipment. There are some facilities like MTMI in Wisconsin that will offer training for mammography. So you'll do the book work through them, and then you'll go to the hospitals, and at the hospitals you'll get your actual training on real people. And then once you've logged a certain amount of exams, then you are ready to set for the ART certification on mammography. So these are what some mammography images look like. So that is another one that would be an option for you when you get out to clinical. So hopefully you found this useful. Take a look at those videos that I posted because there's a lot of good information in those videos. Have a great rest of your week.